Go here, here, go live. There it is. Well, welcome to Integrated Health of Indiana 7 o'clock talk. And tonight we have a very special presentation that we're going to do. We have integrated shockwave therapy. And actually, this is something that Jessica wanted to bring in. And you want to talk a little bit about it, explain it, and then we'll show them the demonstrations.
So we're quite excited about the shockwave. So shockwave therapy is not shocking you, first of all.
It's a misnomer.
Yeah, it's sound waves. And I've been researching this for about a year, off and on. It's really good for chronic issues that traditional therapies and things don't resolve.
So musculoskeletal complaints that don't go away. So plantar fasciitis.
Wonderful for plantar fasciitis.
Shoulders.
Back pain. And shoulders, if you work them, now they do take 3 to 5 sessions, but it can keep you from having to have surgeries.
And so
wait, we got the foot, shoulder, elbows, tennis elbow, golfer's elbow, lower back pain, especially if it's radiating. You can really work into the glutes.
Piriformis syndrome.
Yep. We've done IT bands. We're working on IT bands. That's that stiffness in the side of your hips. It gets super, super tight. Knees.
That back pain that's between the shoulder blades, because I get that rhomboid pain. It has taken my rhomboid pain totally away.
And then, of course, the feet.
Yep.
You can use it on any joint. You can't really overdo it with shockwave therapy. It's sound. There's some exclusions, like you wouldn't want to have a pacemaker. You wouldn't want to be a diabetic where you couldn't feel your feet and then have somebody work on your feet. So there's exclusions that we go through with an informed consent, and we talk about the therapies and what it entails and who shouldn't have it and who should.
Well, and also what she did not say is it actually does very well for erectile dysfunction as well. So if you have a vascular form of erectile dysfunction, if you have cardiovascular disease that has also led to, a lot of people don't realize that if you have cardiovascular disease, your chances of having a vascular type of erectile dysfunction are great. And this breaks down the hard fibers and allows angiogenesis, new blood vessels to form.
So it breaks down scar tissue, breaks up deposits, calcium deposits, whatever deposits you have in that's catching in your muscles. And then, of course, it brings blood flow, which helps regenerate the blood vessels and the nerves. So here we are doing feet. This is wonderful for feet. We had a gentleman that has suffered for 15 years with foot pain, and he got relief on the first visit. Now, you're not going to get your problems aren't going to be solved on one visit. So it depends on how long you've lived with this chronic issue as to how many sessions you might need. So we've done it now long enough that a shoulder, we really see great results in about 3 to 5 visits. Feet, we get really good results on the first visit, but it takes 3, 4, 5 visits. Lower back pain, it takes a couple visits. So it's hard to label. You know, you're going to need more visits if you've had this issue longer. Now, this is feet, so we're working with the tendons, and we find that if you work with the ankle, the tendons and ligaments in the ankle, if you break it up into the calf, and then you go down to the feet, you get a much better result. Now, that's what the noise of the machine makes. It's shockwave, it's sound. It is not actually shocking you.
Not electricity.
It is not comfortable. It's breaking things down, and it should not be painful. It should be bearable, but it is uncomfortable.
I would say that after the first one, I like it. She's actually working on me there. And I have run thousands upon thousands of miles. And so I don't have plantar fasciitis now. I've had it in the past, but my calves are, anytime I try to run now, it tears me up. Now I can get up in the morning and I don't have any issues with my feet. I never actually realized I had issues with my feet until she started doing this on my feet as a guinea pig. And I would stand up and I didn't realize in the morning I would get little zips and tingles and they're gone.
Now, this is super quick. This is not something that's going to take you 30 minutes. Feet are about 7 minutes a piece. About 15 minutes and you can have both feet done. It's about 7 minutes per area. You can do the lower back in about 7 minutes. We can adjust the frequency and the energy based on the person's tolerance. So this is Trevor's feet. We've done his shoulders. I'm actually using sound. So the sound waves work with the oil that's on the skin. A lot of people use ultrasound gel. Now, we are very natural in our clinic, and I don't like ultrasound jelly. It's got a lot of chemicals in it. Petroleum. And it's also got air bubbles, so the sound has to break through the bubbles before it actually starts working. And so this is castor oil, organic castor oil, and castor oil has anti-inflammatory properties in it. And so I start out with massaging the castor oil on, and then use that to work with the wand. And then, of course, we rub it in the end.
And it feels great. I mean, I can take my arms out to the side and go all the way over my head. And swimming, so when I would swim for Ironman competitions, we're talking about, hundreds to thousands of miles, and I would feel it in my shoulders. And a lot of diabetics and pre-diabetics, that's where you feel it first. And I have absolutely been pre-diabetic. I probably was diabetic at one point in time, but I didn't know how to do my labs, 10 to 15 years ago. And so now I'm not, but the shoulder is one of the first things that diabetics will feel, and they don't actually make the connection. And this starts to break that up, allowing blood flow in there, and it just feels so good.
Now, Trevor has a broken collarbone, so his landmarks are a little different. So you'll see me feeling around, and I'm basically finding the bony prominence in his shoulder, and I'll run my finger down. So if my finger's on top of it, I don't hit it. So we're really careful. Comfort, it's not painful, but it doesn't feel good to hit bone. But you'll see me running over him, and you can feel that. And it's unpleasant at first, but once you break that up and you keep going back over it, the tenderness goes away. And that's kind of the goal of each session. You just keep working and working, and you find a spot that is uncomfortable, and you work a little harder in that area.
I absolutely love this, because especially if you are a weightlifter and you do back, and I know I don't look like a weightlifter. I lift weights to just stay in shape and keep muscle tone. But when she gets to those rhomboids, oh my God. And those are the little muscles between the shoulders. And so she's actually teaching a staff member about the bony prominences and what to go to and what to avoid. But all of that right there, a lot of people that get pain on the top of the shoulder, that it, she says it hurts. She's giving you a worst case scenario. I absolutely love it.
Well, and I say hurts, meaning it should not be painful. It is uncomfortable, and your pain tolerance or comfort level, somebody else might say it feels good, and somebody else might say it hurts. But with our machine, we can adjust how fast that actually taps. It's more like tapping, and how much energy is put in with each tap. So it can be adjusted for everybody's tolerance. And there's multiple heads. You can do tight areas, more diffuse. And this is probably one of my favorite things because everybody 100% feels better when they leave.
Yep. And so this is Shockwave, and we are very happy to be the only providers in our area with it. Once again, bringing you the cutting edge of therapy and integrative medicine and things that just help the body do great, feel great, and do well. This is another way that we help you heal from the inside out.
Yeah, what's the next thing?
The next one is
I'm working on the other shoulder, and I'm just running that through the pec. But that noise, it's a tapping on the body. It's the oddest sensation, but you can feel that through your joints, and it kind of feels like a tap, and then kind of like a little explosion inside. It's just it carries through, and after a while, it does feel wonderful.
I'm a bit of a nerd, and so when you're looking at the end is a fan, and inside that wand there is an electromagnet, and what happens is it pulls a plunger back, and then it releases the plunger as fast as electricity will allow, so it changes polarity back and forth, and so it is driving that in. And then you can go from a large head to a very pinpoint head, depending on what you have to do. And once again, for shoulder pain, elbow pain, wrist, knees, ankles, hips, back, neck, rhomboids, pecs, piriformis, and like we said even before, because it brings blood to the area, if you are a gentleman that actually has problems with erectile dysfunction, go look up Shockwave Therapy for that, and you will see reams and reams and reams of information on that. I don't know if it was actually designed for that first, and then everybody figured out it felt great on the muscles, or vice versa.
I'm not sure. So if you're local, meaning North Vernon, we're located in North Vernon, and we have an office in Columbus. But if you're local, come see us. We're having an introductory offer, $25 for one area on your first visit. After that, it's $75 an area. Feels absolutely wonderful, and you will leave feeling better immediately. This is not a treatment that is recognized by the FDA, and so it is not covered by insurance. So it is a cash service. But if you're not local, find this. It is hard to find. You have to call around. But anybody that has had it, I went to a networking thing, and I didn't have to market my Shockwave Therapy because the people that had Shockwave Therapy marketed for me. It's available. You can find it. It's available, but try it. Especially if you've had a chronic issue that's failed traditional methods of treating.
It is a wonderful, wonderful musculoskeletal therapy, and it just brings motion back. It gets rid of pain, and it's not invasive.
No,
at
and
all.
Another thing that it is actually good for is if you have a fracture that is slow to heal, it actually will help build bone.
I bet you that'd suck. Well, once again, this is how we are trying to help you heal from the inside out. This is a little more outside in with stimulation, but that's what we're here for. We're here to help you. And if you have any questions, hit us up. Dr. Miller at Integrated Health of Indiana or Mrs. MRS Indiana Backdoc at gmail.com, or feel free to call us on the landline 812-346-1757. Thank you. Have a great evening.